The silence is deafening. No patient voices can be heard. Only the constant bleeping of life support machines. This is the Children's Intensive Care Unit at St Mary's Hospital in central London.
We're just waiting, they're going to discuss them in the NBC tomorrow.
Yes, I can put them all over the ground.
Yeah.
But there is no more space here for critically sick children. This is now a COVID-19 ICU, full of adults.
First, important to realise that we're a children's intensive care unit, and as you can see, we're full of adult patients, so which demonstrates the amount of pressure the system is under. People have said, you know, this isn't a problem for children, but the indirect impacts of this pandemic are affecting children really badly. The normal healthcare system that we have for children in London is severely affected. So I wouldn't say children are not being treated properly, but clearly some of their care is compromised because of the changes we've had to make to accommodate the adults.
Just like hospitals across the country, the sheer volume of admissions means that St Mary's has been forced to increase its capacity. And that means new space constantly needs to be found to treat a rising number of COVID patients.
I think this is worse than the first wave. I mean, we know from the numbers there are many more patients being admitted to hospital, and there are many more patients being admitted to intensive care. And I think the issue is that this peak, whenever it comes, is going to take longer to dissipate, whereas the first wave was kind of short and sharp in a way. This is going on for longer and is going to be a higher peak.
Every single patient here, except one, is sedated.
There are 13 patients on this ward. 12 are on intubators and they're in a coma. The doctors are using ventilators to keep them alive.
Patients deep in induced comas know nothing about the tender, devoted care they receive. The machines help their virus-infected lungs to breathe, but everything else has to be done by a dedicated team of doctors and nurses. This patient needs to be x-rayed. Maneuvering an unconscious, heavy adult is challenging.
All right. And if I can get him to come to you, we'll do slightly towards the middle. That's fine, yeah. Perfect.
All the staff here are trained to treat sick children, their nurses and the doctors.
Yeah. So we keep them stuck on here just so we can use them when we go back to the people.
They've had to learn to transfer their life-saving skills to adults. The physiotherapists normally treat children who weigh around 10 kilograms. Now, they're having to prone adults who can weigh 10 times as much. The paediatric staff have had to adapt. Family liaison nurses, Jo and Helen, have the impossible task of acting as the only link between these patients and their desperately worried families. COVID-19 is doubly cruel, taking away lives and any chance of a final goodbye.
Nothing can really prepare you for seeing your loved one in intensive care with all the tubes and lines, and it can be quite scary. So before we do it, we have to prepare them. And, you know, quite often they're breaking down on the phone, and normally you would hug them and tell them, you know, we're here for you. You can't really do that when they're, you know, at the other end of a camera, so it's hard. And the end-of-life situation is the hardest, where we might allow one family member to come in. So the family has to decide, don't they, Jo, which family member's going to come in. They have to wear full PPE, and we might have a FaceTime camera so that other family members can be there virtually. But a year ago, would we ever think that that was normal, to say goodbye to your mum on an iPhone, on an iPad? Whereas now this is sadly happening quite a lot, isn't it?
We were all hoping desperately that we wouldn't have to go through this again. But I think we got through it the first time. So we know that, we're hopeful that we'll get through it again intact.
13 all
13
intubated.
altogether. Yeah,
Okay.
13 all intubated. The 4, you're not trying to wake up today.
I don't know what happened.
Bed
4. No, not bed 4, bed 7.
For Professor Nadell and his team, it's a constant battle. The struggle to find beds, to accommodate other hospital requests to take in their sick. And this pressure is being felt right across London's healthcare system. This hospital is not overwhelmed, but it is pretty close.
The next few weeks will be critical. At the moment, if you look at the community transmission, it's certainly not rising quite as fast as it was. In some areas, it's falling ever so slightly, but I think we need a few more days to see whether that continues. But even once it starts to fall, we know that the pressure on the NHS carries on for some weeks after that. And so that's what we're preparing for.
Are you worried?
I'm concerned, but I say I've been so impressed by the way that everyone has pulled together.
The hospital's paediatric ward is now also full of adults with COVID-19. The emotional toll is beginning to tell.
There's one gentleman who was just so sweet, and we really got to know him quite well, and then he just deteriorated overnight and passed away. And he was talking about his boat and things like that, and being on his boat, and then there was pictures of him with his big steering wheel on the boat and stuff like that. And it just, for some reason, when he passed away, we took all the pictures down, and I sort of broke down then.
This deadly crisis that has gripped London shows no sign of easing. It is real. The patients here would say the same, except they're too sick to tell you. Ashish Joshi, Sky News, St Mary's Hospital.